Bishop. In this week's segment of What Women Want, we are discussing women and smoking. There's a few issues surrounding women and smoking, such as passive smoking, stress, suppressing appetite. So we've got a GP here with us today to help us. So just come with me and we'll ask him a few questions together. Shopping Centre for Family Dr. Week. We have Julian Chan here to help us out in answering a few questions about women and smoking. So, Dr. Chan, does smoking affect pregnancy and how?
Yes, Pamela. Smoking does affect pregnant women because what happens is that there's a lot of toxins inside the smokes and also reduces the amount of oxygen that goes to the baby. So things like miscarriages are more likely to happen. Things like premature and low birth weight babies are more likely to happen as well. And even after pregnancy, I guess the children's lungs are a little bit less developed and they're also at risk of getting things like asthma.
Is it true that smoking makes you lose weight, or is that just a myth?
Yes, smoking can reduce your appetite, and I guess the other thing is that you're doing something else instead of eating, so I guess it's also a little bit of a distraction. But there are better ways of losing weight than using smokes. You can see a doctor about getting medications, or you can see a doctor about weight loss advice, you can see a dietitian, you can see a lot of a whole host of different allied health workers that help you to lose weight, or even just from the media and things like that. There's some really good information out there now about how to lose weight, rather than using such a, I guess, destructive method of losing weight.
So, can you list any of the side effects that you might get after using cigarettes as a weight management system?
I guess the side effects are the long-term complications of cigarettes. The immediate ones are like it can affect your breathing, like trigger off asthma, make you have irritated eyes or trigger off allergies and things like that. In the long term, then I guess it can cause lung damage, heart disease, strokes, and a whole bunch of other complications. And I guess the more scary ones are things like cancers and things like that as well.
Yeah, that's definitely scary. So, how about wrinkles? Are you more likely to develop wrinkles and dry skin from smoking?
Yeah. The amount of oxygen that goes into our body is affected by the cigarettes because there's things like carbon monoxide and things like that which reduces oxygen. Not to mention the fact that there's a lot of carcinogens in the smokes and it releases a lot of free radicals or oxidants. We're burning things here, and so what happens is that then it obviously circulates around the body, and some of the effects will be to the skin. The blood will bring the poisons to the skin and will obviously damage it.
Oh, that's terrible. Does smoking increase women's chances of getting breast cancer?
Yes. Smoking does increase your risk of getting a lot of cancers. One of them is breast cancer. It also can increase things like the cervical cancer and did we say breast cancer? And lung cancer, yeah.
Okay. Thank you very much for joining us today, Dr. Chan. We really appreciate your assistance and advice. Thank you. Okay, so as we could see from Dr. Chan there, he had some pretty important stuff to say, like getting wrinkly. I mean, I'm sure being a women's program, we understand we don't want to be getting wrinkly any time earlier than we need to. And he also did mention a few other severe effects there, like the cancers and the stuff about the kids and that. So, if there are any smokers out there, hopefully this gave you a bit more insight